Thank you all for joining us. I know this is kind of the new normal, I guess, for most of us doing Zoom calls. Hoping that we could kind of set this up as a virtual happy hour for our section, but I see a lot of hospitals and everybody's Zoom background, so if you can get away with it, cheers to you guys. But I really just wanted to kind of take the opportunity to kind of thank everybody over the past, almost 5 years, if you can include all the remediation term changes and stuff that I've been, chair-elect and section chair. I think we've really been able to accomplish a lot over the past few years. And I'm really using this meeting to kind of hand off the gavel and pass the torch to Aaron and Jeff, our incoming chair-elect, chair and chair-elect, and also garner ideas for them to kind of keep the momentum moving forward in lieu of the pandemic and all the other great work that we have and engagement that we have within our section. So we just kind of wanted to highlight a few things. Aaron, I see you got the slides up that we kind of put together earlier today. So covered bullet one. For those of you that do not know me by now, Jason McKee, and you guys have received my plenty of emails and stuff over the past few years. Aaron is our incoming section chair, and Jeff Mucksavage will be our incoming chair-elect. Eljim is our current board liaison. And Teresa is our newly re-elected board of directors member out of the pharmacy section as well. And I know John Lewin is also currently serving on the board of directors as well. So, and then Claire. Oh.
I was saying I roll off this. Yeah, I roll off this year, Jason.
Okay. Which brings Teresa back onto the board as our pharmacy rep. So, and then for those of you that do not know, Claire is our NCS section liaison, and she kind of helps to facilitate all of the interactions between our section and NCS proper. I did kind of want to highlight a few section achievements. I thought we've done a lot of great work and continued some momentum even in lieu of COVID. Big kudos to Aaron and Morgan and the rest of the pharmacy team for getting the cerebral edema guidelines published this past year. We've also been able to launch the NCS pharmacist orientation course as a new educational product this year. So kudos to the work by that group with educational products under Teresa's leadership. And we were able to launch also the neurocritical care on call pharmacotherapy chapter, again, through the educational products group. And then I didn't have a chance to reconcile all of the publications from this section, but, the Neurocritical Care Journal had a slew of our engagement as a section, and pharmacists lead authors on a ton of publications this year, which we'll highlight hopefully in our year in review with the Currents newsletter this fall. So I want to turn it back over to Aaron, though, to kind of highlight some of the, highlight the section leadership here. But then I do want to turn it back over to Aaron, who's been heavily involved with our research subsection and kind of get ideas, get some updates on the current research efforts, as well as garner some ideas to kind of what to focus on in the upcoming year.
Thanks, Jason. Yeah, I'll just kind of put this up so that people can stare at it, so they don't have to stare at me. But I'll give you a little bit of a research update. Our pharmacy section has been, really phenomenally productive and has really been a model for doing multi-center studies in a sort of streamlined and meaningful way. And we really have been very active over the last year or two. despite some of the challenges that I think we have all encountered with the current state of affairs. So there's a few things that are sort of out. Our goal really as a research committee, and this is one of the areas when we talk about getting involved that you know, our membership could be involved. But where our goal is to have multiple projects going at the same time, but sort of stagger them so that we're writing on one, we're data collecting on another, we're thinking about how we're going to do the next one, and that way they're all sort of in different phases. There's a few that we've had a backlog of writing and data analysis. So there's a couple that are sort of working their way towards publication. One that we did a number of years ago looking at PCC administration and kind of how the drug was being infused and repeat doses and stuff. That the manuscript has been circulated to the authors, and it should be, that process can take a little while if you're getting a lot of input from people, but that should be something that goes into submission at Neurocritical Care in the next month or so. Many of you contributed to the stress ulcer prophylaxis and subarachnoid hemorrhage study. We have really interesting data. I mean, our bleed rate was nearly 5%, which is way higher than, you know, most critical care patients, and actually things like ICP elevations and vasospasm popped out as a risk factor for GI bleeding, which I think is going to be a really cool publication. We've gotten 2 rounds of comments from the reviewers at Neurocritical Care on that, and we're pretty close to having that being done and put into press, hopefully also in the next month or so. We completed one based on our discussion last year at the meeting called Fix ICH, and that was focused on reversal of DOACs and using prothrombic complex concentrates. That was published in Circulation. It ended up being a really big publication, over 600 patients with a great deal of data. And so we're still working on elements of that study because ultimately the idea is to compare PCC and andexanet, and so we're recruiting other centers that are using andexanet. And so if you are a center that's using andexanet and you'd like to contribute some of your patients to this study, we should have a pretty big cohort. And then there's a couple that are ongoing as far as idea generation and design, and they're going to start here in the next couple months. One that is being led by Casey May and Devin Holden, that's focused on the IR area and how we're using antiplatelet testing and rescue therapy. So that was proposed by Casey several years ago, and we've been working our way towards doing that. Now that we have a good critical mass of patients, probably I think we're good there. And Sharif Mahmood and Gretchen Brophy working on a nimodipine adverse event study. So if you've been on the message board and all that, hopefully you've seen links to being interested in that and expressing your interest, and those will go out. Those are there on the message board for you to see. So we've been really active. I'm transitioning off as chair, and on the research committee, that person kind of stays for a couple years. Nick Panos, who's been on the committee for several years now and was the lead author on the Fix ICH study, is taking over as chair for the research committee. So with that, I hope that's a good review. If I forgot anything related to projects that we have worked on, let me know. And I think at this point, I don't want to have, you know, an hour of discussion necessarily, because we do have some other points we want to talk about. But I think now would be an awesome time if people have thoughts on other things that we can do as a section to work together to do high quality research. I think now's a great time to share some ideas.
Aaron, it's Chris. Have we ever thought of building some type of REDCap database that we could input data on multiple things on and data mine from as like a neurocritical care pharmacy database that's multi-center?
That's a good question. So almost like the Prince study in some respects that they did in the organization a few years ago, where it was basically a huge snapshot study. We did try to mine that, and they didn't collect a lot of medication related things. But
can I just jump in and interrupt, because as the engagement leader for the Curing Coma campaign, I should let you know that we could use all of you guys to help us with the discrete data points that we're looking to collect from all of these institutions. So if there is a pharmacist that's willing to be on the discrete data sub-module, please let me know. I would love to get you guys involved, because we'll get that once we've decided what variables we want. We'll put it in the Curing Coma database, which is being developed, and we can mine the hell out of it. So I really could use some input from any and all of you guys.
A great point. Obviously, the Curing Coma is a huge, huge campaign for neurocritical care right now, and so there's definitely a tidal wave of momentum with that. But I get your point, Chris, and I think that's an interesting, it'd be an interesting thing. I think if it's probably easier for people to buy into if we had specific things that we might want to look at, just for ease of data collection and stuff. But, maybe
I really think we would be doing two separate data sets as well. The big, huge one, and then if we want to collect something different, I think that's fantastic, and we can add it to that data as well. But this is really the time. If we really want a bunch of data sets for prospective studies or retrospective studies moving forward, this is the time for us to figure out what those discrete variables are and get what we can.
Yeah, definitely, I agree. Adding to the Curing Coma campaign, data sets, big data set, when you're creating the elements, it's very important. Like one of the usually big missed ones is the medications, like the medication dosing specifically, and they compare lots of studies, and they say no changes happen to the other medications, but we really care about these, how they are dosed and what medication are on. It's nice, if they are building these databases, we have our input to have the pharmacotherapy side of those studies, because they are usually missed in larger databases.
Do I have a volunteer to be on the discrete data module? Come on. Come on. Sean Rowe. Okay, thanks.
Okay, so Aaron, can I add something about the nimodipine study regarding recruitment? So we are currently, we have participation of 28 different sites throughout North America, which is amazing. And if you still want to hear more, or if you're interested to participate, still it's not too late. So you can just send me an email, and I can discuss that with you. And I see many of you also in the call is already in the study. So thank you for your support. It's going to be great, hopefully.
So just out of curiosity, how many of you guys see a lot of endocarditis? In East Tennessee, we have a ton of IV drug use that results in endocarditis that eventually ends up with a mycotic aneurysm of some sort. One of the things that I've often thought that would be interesting for us to look at as a group would be outcomes associated with different treatments. And so be it cefazolin, be it NAF, OX, or even VANC, Dapto, whatever you want to go with, right? So it's kind of bringing an ID slant into the neurocritical care world and specifically looking at that subset that has a really horrible outcome anyway, as far as myocardic aneurysm patients are concerned. But, you know, with a very high incidence of having some sort of bad outcome occur, usually it makes it a little bit easier from a power standpoint to be able to find a difference in things that are going on. So just one idea that I've been kind of rolling around there is looking at that subset of patients. And, you know, we have quite a few a year that we take care of here in East Tennessee. And so if there's a large enough population out there, that might be something we could go down that route of.
I like that too, because that's some of the other, just to add on to Sean's point, a couple of other things is, you know, we have done a couple of studies where we've been able to work with industry to get some funding. I think with the opioid epidemic and stuff like that, I think that's probably an avenue, you know, for something like that to support some of the research being done, which would be pretty cool. Most of our projects to this point have been retrospective, where we're basically, you know, doing, you know, 40, 50 patients over the last few years or whatever you can contribute. I do think we have, I think we have a group that's growing in not only size but expertise to be able to execute a little bit higher level stuff as well. Not that, you know, 17 or 20 centers giving 50 patients isn't high level stuff, but, you know, I think we're pretty close and poised, I think, to start doing some more prospective stuff working together. And so just some things on the radar as you're thinking about other ideas. It doesn't have to always fit in that sort of format that we've always done. Yeah, so I'm seeing comments too about, you know, the endocarditis, mycotic aneurysms also. You know, it's funny, we had, during the annual meeting committee this year, we had a whole discussion about, somebody had proposed that, and the team that had reviewed it was like, I don't know. And then, but everybody was like, oh my gosh, I see so many mycotic aneurysms now, you know, and that would be so great because we don't know what to do, and, you know, and all this stuff. And so, you know, evaluating those would be kind of cool. So I'm just jotting these down, and we'll kind of flesh some of these things out, you know, as we go. But
one of the things we see a lot in Baltimore, at least, I don't know if other people see this, but with our ICH patients, it's not uncommon for us to see people that come in with systolic blood pressures in like the 250s, 260s, 270s. And then, you know, we're sort of stuck in this hole of what do we do with those patients as far as blood pressure goes, comparing to like the ATTACH and other studies. I mean, I know they keep publishing more and more from those data sets, but they're not huge patient populations. I don't know if a lot of other places see that level of hypertension, but we're always a little bit taken aback by how much, how hypertensive some of our patients are when they come in.
okay, well, I think that these are all great ideas, and I think what we'll do is if you have any other thoughts or just topics maybe that you think are hot or ripe for study that, you know, are sort of in the pharmacist domain to some degree, you know, maybe just put them down in the chat. We'll have record of that. We can go back and work with people to sort of flesh those ideas out and see where we might want to take that. You know, I think part of the other goal of the research committee is to help people take ideas and then make them into something that we can all do and that can be valuable, you know, to publish. So, you know, even if you just have an idea, but you're like, I'm not totally sure how I would pull that off, you know, I think that's part of the goal of the research committee and our group. So, you know, let us know what ideas you have, and then we can figure it out from there. But I think in the interest of time and just staying on track, maybe we'll move on. Jason, did you want to talk about Get Involved, or do you want me to talk a little bit about what we do with that?
Yeah, I can speak to that. So every year, as you're registered for the section, most of the names that I'm seeing on the Zoom are very familiar with the Get Involved campaign. But for the newer members, it is definitely one of the easiest ways to kind of get involved within the NCS organization at large, and also within the section itself. We really take the list that we get generated from NCS and assign people to various committees to get involved with those respective committees, and then kind of report out to the pharmacy section. So I can't stress enough and encourage everybody to kind of make sure that they're responding to that survey when it does come out from NCS. It's usually springtime. But that is probably one of the best and easiest ways for all of us to kind of get involved further with the organization. And which kind of ties into 2 bullets from there is our speaker interest spreadsheet, which is kind of pinned to the section homepage. It is a just Excel sheet on a Google Doc, which has everybody's kind of speaker interests and topic presentation interests. And I definitely encourage everybody to kind of keep that updated. If you have any interest in speaking for any of the pharmacotherapy workshops or sessions at the meeting, that spreadsheet is definitely heavily relied upon by our liaisons to the annual meeting to kind of place speakers of various expertise and stuff throughout the schedule for the annual meeting. So a lot of the speakers that have been selected have been off of that spreadsheet. So please check that regularly and update the information. Usually around this time, around the annual meeting is a good time to just remind everybody to kind of visit there and update the info there. So. And then the last bullet for the greater group is just member ideas and see what can Aaron and Jeff kind of carry the torch on, and with NCS proper, and what other stuff would you like to see this section do kind of moving forward. I will plug the fundraising efforts for the virtual run for research for next week to make sure that we continue to remain fundraising champions as a section. Thanks to Elgin, and yes, donate to the pharmacy team. I did receive notice that my running attire shipped today, so.
Yeah, if everybody could please donate what you can. We were the top fundraisers last year. We raised about $1,000 for a run for research. So this year I'm hoping to keep the standing alive for the pharmacy section. So you should have received email or a message from the NCS pharmacy section with the link to the donation site. So please give what you can, help support your fellow team drug runners, and let's do this for next week.
Elgin, this is Chris. Would you mind resending out that link for us who might have accidentally deleted it?
How dare you? Yeah, no problem. And just so that everybody's aware, the speaker list is also under the library, under the pharmacy section. So if you're looking for it, I don't see it pinned anymore to the top. I don't know what happened, but the actual Google document is also listed under the library. So it's a pharmacy speaker list. You can access it that way as well. So please, definitely, if you haven't entered your information, if you're a new member, definitely add your name and your content expertise to the list. And for those of you who are already on there, update your information. If you have a new content area of expertise, add that to the list, because we're always looking for new speakers and new topics.
I mean, just to speak to that real quick, as the incoming chair, one of my jobs on the annual planning committee is to put together the pharmacotherapy workshop, which is on Tuesday. And literally all 6 of the speakers, I just went to the spreadsheet and took ideas that people had said, hey, we want a topic on this or that. And then I said, okay, what person do we have that says that they have content expertise in that area? And so it's definitely utilized heavily, at least it's something that I used a lot. So it's important to put that in there. If you want to be involved and be under consideration for stuff like that, I think it takes 2 seconds to do, and it puts you on the radar for sure.
Eric, can you see about pinning that spreadsheet or that document to the top of the discussion board?
Yeah, I'll work on that. I'll either delete it or pin it, one of the two.
Well, copy it before you delete it.
And it's a good reminder, and I'm glad you said that, because for some of us who've been around for a while, it might be have been a hot minute since we've updated stuff on there.
So what else do we want to talk about?
So, hey, this is Chris. I've got one thing that I became a member at large for the SCCM Neurosciences section. And the leadership for that is a lot of our NCS people like Loya Shutter and that, and they're wanting to make it more multidisciplinary within that section to kind of mirror NCS. So any of you pharmacists that are SCCM, if you're not already a neuroscience section member, please join, and please, if you want to be active and do some stuff, they're looking for more activity to mirror what we do from our group in here with that group.
Do we have numbers as to how many pharmacists are registered for next week's meeting at all? Or for the workshop, you have a good group registered?
For the workshop, I haven't actually heard the last numbers. If Claire's still on, she might be able to tell us, because things have been sort of changing pretty rapidly with people signing up. But if I remember right, we were at least at 75 or 80.
Nice.
That's a good number.
I don't have it off the top of my head, but I can check with Alex real quick.
That'd be great. Thank you.
We're also looking for people to attend the sessions and also tweet out or use social media to tweet out some of the activities of the meeting. So if you're in a session, feel free to tweet or I don't know, just advertise the sessions. I've been trying to post a lot of the pharmacy sessions on Twitter. Trying to get people interested in registering for the meeting, and I'll do the same thing for the workshop. But if everybody can just be mindful about definitely pushing pharmacy speakers off onto social media as a part of NCS, that would be great.
So I have a question about that. Question. So like if we're taking pictures, like because now it's a virtual meeting, right? Like regarding, is there any privacy thing like we need to worry about? Like because people will be having their cameras from home, maybe. I don't know how the interface will look like. Like can you just take a picture of someone presenting and then post it, which is okay because maybe some other people will be in the background, or if it's fine, it's fine. But like I just want to make sure.
Actually, all the presenters will have, if you see the background that I have, I'm trying it out, all the presenters will have this background. So this is what it will look like, you know, when you're listening live. So there shouldn't be, unless something has gone awry, there shouldn't be anything in the background.
Yeah, okay. Because like I had the same thought like when we were teaching virtually, like from our students, we have some privacy issue. Like we told them like some of the sessions will be recorded. Make sure your background is clear.
So Claire just posted that the pharmacy workshop has 75 currently registered, which I think is a good number. And then I also posted our leadership section, basically an electronic report. In lieu of having a meeting today, since we're on this, we just did an electronic report, which has a lot of the sort of goings on of the committee, but also on that, at the bottom is a speaker list for all the pharmacists who are speaking at the meeting. I did not include posters, but the poster interface is actually going to be pretty cool. So you'll be able to kind of peruse all those, but take a look at the document in the chat and maybe bookmark all those pharmacists that we have speaking next week.
Did anyone go through the posters? That's what I was going to ask, and look for what pharmacists were presenting posters or had them accepted. Eldon, that's usually you, baby cakes. Eldon.
But I didn't have access to the posters or the abstract, so I couldn't make a document, but I don't know
if you go to the poster session, though, you can see the name of the poster and the people that are on there.
Yeah.
I feel like you kind of know everyone between you and Jeffrey.
Well, we could, absolutely.
I love you.
I'd like to have it ahead of time so that we can distribute it to everybody so that we can get a good showing. But so for this poster abstract presentation, are there different like platform poster presentations, or is it all just poster presentations now?
My understanding on that, there's a session for platform presentations, which is already scheduled, and there's at least one pharmacist presenting in that. There is still sort of the professor Zoom rounds, I guess. You know, and so there'll be sort of this scheduled time for when they pop by to talk to whomever, you know, is whoever's doing the poster. So I'm not exactly sure how that will work. I heard it yesterday, but I am having trouble wrapping my head around that. But I think hopefully that will be pretty self-explanatory. Navigating the posters looks really easy.
Cool.
So, other question: do you have any new members here in the meeting, in the call here? I'm just looking. Any new members?
Yes, right here, Lauren Sutton.
Hi, Lauren.
Hello.
I'm newer. I think I joined 2 years ago, but I've not met a number of you.
Welcome.
Hey guys.
I've got a new member here too. I actually just recently transitioned to become the formulary management and drug use policy specialist here. So Laura Schneider is going to be the new neuro ICU pharmacist at Christiana.
Hey, everybody.
Welcome, Laura.
Welcome.
I'm also new. I'm a pediatric pharmacist over at Texas Children's Hospital.
Oh, Peds Neuro?
Peds Neuro and neurocritical.
Excellent.
I think I know.
Hey, wait. Elgin, I want some Knob Creek.
Here you go.
Is that the 120 proof?
It is.
Nice.
It's been a rough week. Listen to Epic, and we have a nursing strike ongoing. So and staff strike. And staff strike. So,
Wow.
Cheers.
Welcome to Epic, Jeff and Elgin.
Is that? We're clearly doing shit wrong over here in St. Louis. Definitely. We're moving to Chicago.
Welcome to Suleiman too. Thank you for putting that in.
Yeah, welcome.
Hey, Jason, I had a quick question. For you kind of mentioned like Twitter and things like that. Is there like a specific hashtag that you all thought about we should use so that we can follow easier?
There are. Oh, go ahead.
We've been using hashtag NCS Pharmacy, also hashtag NCS 18 for the meeting.
NCSM18 for what? Sorry, I didn't hear that.
The official hashtag for the meeting is NCS18.
18. Oh, yeah, because it's the 18th. Okay.
And then for our section, we've been just using NCS Pharmacy.
Thanks, Kimberly. Yeah, sorry. Thanks, Kimberly, on the Journal Club, too. We just did one of those today. That reminded me that Corinne wasn't able to make the call today, but she wanted me to plug the Journal Club. It sounds like that the requests for being part of the Journal Club have gone up. Our attendance has been good. And so I think they're contemplating doing it a little bit more frequently. So if you have learners that would like to present in that Journal Club, go ahead and reach out to Corinne, and she will work to set you up.
So when Aaron and I were putting this together, the agenda for this, we were planning to have just the new members kind of stick around just so that we could answer some questions and review kind of just NCS structure and how to get involved for the newer members. So before we get to that, since the bourbon was already brought out, in lieu of our virtual handoff, I don't know how I'm going to get this to you, but Aaron, this is preparation for your upcoming term. I'll figure out a way to ship it to you in the next week or so. But hopefully this will come in handy for you. But thank you for all of your support over the past 2 years and all your hard work with the annual meeting committee and with being involved with the research group. You know, the success of this section would not have happened without all of your efforts. So thank you. Provided I don't drink this first. So.
Yeah, I was gonna say that it looks like Willet. That a little bit of Willet will go.
That's a little bit of Willet.
Yeah. Well, thank you for your generosity. I think, you know, hopefully I speak for the rest of the group when just in applauding you for your professionalism and leadership over the last 2 years. It's been awesome to work with you. I was emailing back and forth with Corinne today and just saying, like, I've been watching everything Jason has done just so I don't, if I at least do what you did, then I won't mess anything up for sure, and we'll definitely be on the right path. So thank you for being on task and working so hard to represent our group and move things forward. A lot has happened in the last 3 to 4 years for our group, and you know, between you and Elgin and Teresa and Gretchen and others, it's doing a large part to you all. So thank you.
Hopefully the last of the remediation years ended with Elgin and I, so.
Now, with Jeff and I, it's full on, like, what's past remediation? I don't know.
No, but again, thank you everybody for all of your engagement. You know, during my terms as your section chair, you know, everybody has really stepped up to, you know, really move our product offerings and our section forward, and hopefully we can keep the momentum. So with this, a little over 10 minutes left for the more seasoned members, allow you guys to fall off and get back to happy hour if you're able. And we'll kind of keep the meeting going for some of our more junior members and newer members just to kind of give them a proper toast and cheers into the section. Good to see everybody virtually.
Hey, this is Chris. I got one more thing. Emily just posted one of our Grady PGY1s from last year had a poster accepted and is presenting in the first poster session. She also won a travel grant and some other professor award and was recognized. It's the most recognized poster I've ever seen. You can thank her name's Hannah Leshorn, and then Emily Durr is part of it. And thank you guys for all you do. And then I have one question for the group before we sign off. Anybody else starting a neuro residency anytime soon?
No, we just started a ID critical care fellowship, but not yet.
Awesome to see everybody.
Good to see everybody. Bye all.